moving from a sedentary to a physically active societal way of life. This is Up on Our Feet.
Welcome to Up on Our Feet. It's one of the most common afflictions in today's world, especially with the ever-increasing number of people who are mostly sedentary throughout their working day, sitting at desks, working at computers. And while not mortal, this affliction causes persistent pain and suffering, and in many cases, significantly affects just about everything a person does in their regular daily life. And so what is this non-fatal yet ubiquitous affliction that impacts the daily lives of so many people? It's low back pain. And while many people see a physician in an effort to find relief, there really isn't much that the medical community can do other than to recommend low-level medication and rest. However, there's been some good news regarding the prevention of low back pain recurrence. In a recent study published in The Lancet, research showed that progressive walking and education intervention significantly reduced low back pain recurrence. The lead author of this study is Dr. Natasha Pocovi, a postdoctoral research fellow in the Department of Health Sciences at Macquarie University in Sydney, Australia. The focus of Dr. Pocovi's research is in the discipline of physiotherapy, and she also teaches research methods and evidence-based practice in several degree programs. Dr. Pocovi, it's nice to have you with us.
It's a pleasure to be here, Joel. Thanks for the invitation.
Sure. So tell you what, let's start off with a numbers question. And this may not have been part of your research, but do you have any idea just how prevalent low back pain is?
Yeah, so there was a big global burden of disease study that was published last year. And the estimates are around 620 million people were impacted globally by low back pain back in 2022. So yeah, it's, like you mentioned, a condition that afflicts many people, much more than you probably think. But you know, day to day, you do experience or come across a lot of people who do have low back pain. So also not that surprising.
Right. Okay. And so then, I don't know, again, if you did this with your research, but do they have an idea of what causes low back pain?
Yeah, so I mean, there's lots of causes, but when we're thinking about, let's say, your most typical presentation, it's when you're asking too many demands or more demands than what your back musculature, joints, etc. can tolerate. So whether that's sustained postures or you know, lifting or exerting yourself too much, that's generally where people come undone. Obviously, there's instances, though very rare, where you'll have a, you know, underlying condition, but for the most part, it really comes down to asking too many demands.
Okay, so how did you ever get the idea, you know, with all the remedies that have been tried with regarding low back pain, how did you get the idea to test walking as a remedy for low back pain, and what were the results?
Yeah, so it was interesting. Like all things, you kind of start with a bit of a search or sift through the literature. And we were astounded by how complex we tend to make it when we're trying to treat, manage low back pain. And one area that really isn't explored to any degree is prevention, especially when you compare it to how much research, clinical work, etc., is done in the space of treatment. I would say for every 100, maybe even 1,000 studies done in treatment, there's maybe one done in prevention. So I guess first we honed into prevention, and just to provide a bit of background as to why that was, you know, for someone who experiences an episode of low back pain, they tend to generally recover quite quickly. You know, 80 to 90% of people are going to recover within 2 to 4 weeks. It tends to have a good prognosis. The problem there lies when you have about 70% of people who recover will then have a new recurrence within the following year. So instead of really focusing our efforts on treatment, which is important, but we also think prevention is just this incredibly spot that's missed in the clinical care of low back pain. So yes, first we focused on prevention. Then we thought, hey, let's look into the literature, see what's there, and it's minimal. And typically what we find is that the combination of exercise and education is best. However, the exercises that have been previously explored are often very intensive, either in terms of dose or requiring supervision or the need for equipment. And so you can imagine that all these things accumulate cost and ultimately become less accessible to patients. So taking all these things into consideration, we thought, is there a need or an ability to look for an exercise intervention that is low cost, accessible, simple, almost anyone can engage in? And so that led us down the route of walking. And so we conducted the walk back trial. And I guess that's what we're here to talk about today. Perhaps I'll let you seg in with another question. I've done a bit of talking.
No, that's fine. That's fine. So in the study, you mentioned it was progressive walking and education intervention. So what is progressive walking compared to just regular walking? And what do you mean by education and these combined as remedies for low back pain?
Yeah, great question. So I guess in terms of the progressive nature, like I mentioned earlier, if we're going for or asking too many demands of our back or muscles, etc., that's really kind of asking for injury, right? So we wanted to make sure that we were getting people that were quite sedentary in this study. And so we really wanted to make sure that it was a slow progression from something that was very minimal in dose, and then progress that over time. Now, we were aiming to get people in our study walking roughly around 30 minutes most days of the week by about 6 months into the study, but it was very individualized in nature. So some people were incredibly sedentary, and so the starting point was something like 2 to 3 walks a week, get a dose of 10 minutes. But it's really important to start hitting those goals early, getting accustomed to the feeling of being physically active, and then progressing that over time. And so importantly, this was actually delivered across 6 sessions with a physiotherapist involved. So one element was, yes, that progressive nature, being able to keep in check any potential injuries or troubleshooting in that respect. But also, like you mentioned, half of the intervention was also the provision of education. So education really boiled down to giving people a modern understanding of pain. So, pain doesn't necessarily mean that you're doing more damage. And we really tried to work very hard to educate people, or actually reassure people and reduce their kind of anxieties and fears around exercise. Because for someone who experiences recurrent back pain, there is naturally this sort of hesitation or reservation to get active. And so that was something that we really wanted to change people's knowledge and thinking around that space. And walking seemed like a nice segue to do that in, something that people were much more comfortable in than jumping into the deep end and doing very high intensity exercise, for example.
And so, I know in so many of the interviews I've done previously, trying to get people to be more physically active is really difficult. You literally have to change their lifestyle. Can you talk a little bit about how that played out in trying to get people? You're talking about the progressive walking where you start off at so many minutes and then you increase the dosage over and over until they're putting in maybe 30 minutes at a time. How do you get them to do that?
Yeah, another good question. And it's all in the paper, but we also made sure to upskill our physio. So in this case, it was physical therapist, I believe is the term that you guys use, physiotherapist for us. And we upskilled them in health coaching. Now, that's a skill that perhaps physios possess, but I don't think routinely used. We tend to have a prescriptive hat on where we'll say, this is the XYZ exercise that we recommend that you go ahead and do. But the reality is it's really hard, like you say, to change people's behavior and get them to, encourage them or get them to comply with exercise. So like I said, we paired up with Wellness Coaching Australia, so a a company here that kind of specializes in health coaching training. And it wasn't a lot of training. It was about 5 hours of online modules, followed up by some, case vignettes and just making sure that the physios were actually using these tools. But it was ultimately around kind of motivational interviewing, tapping into, well, why were you even interested in this walking program? What is it going to change beyond just getting you outdoors and exercising more? And once people could kind of dig into that motivation, the physios were then encouraged to sort of use that to really try and convince people or help people understand why this was an important thing to partake in beyond the potential benefits for their back pain. And we actually did some qualitative interviews, so some interviews with patients who were involved in the intervention arm of the trial. And we found that really interesting because that sense of even having a physio on board meant that people felt accountable. So that sense of not wanting to let the physio down, or perhaps not letting me down as the researcher who had, onboarded these people into the trial, that was enough motivation for quite a few people to just get them started. And that's often the most difficult part, right? So you'll start, you might feel good for 1 or 2 weeks, and then life gets busy, and then you kind of falter at that point. But having these 6 sessions with a physiotherapist spread across a 6-month period, we also asked people to maintain things like a walking diary. And there was a lot of planning of, can you buddy up with someone outside of the intervention or join a walking group, like thinking of different strategies, because different strategies are going to work for different people, as to how we could really make this more of a habitual process for people. And in terms of, the accountability element being really important at the start, what we found when we interviewed this sample of patients or participants in the trial was that over time, they actually started to feel better in their own body. So there was a little bit more of an awareness that, hang on, I've kind of backed off my walking. I've been a little bit lazy, let's say, and, I've started to feel a twinge in my back. Or, I'm just not sleeping as well, or I'm a bit more stressed than I was a couple of months ago when I was really adherent to the program. So it was this kind of other global health benefits that people were feeling that really added to people's motivations to continue to be adherent with the program. So it was interesting. You kind of are driven by an external motivator early on, but once people started seeing the benefits, they were really internally driven and motivated to continue.
So it sounds like from all the things you're talking about here, including the physiotherapist, working with them on a regular basis, almost like people who work out, they have a personal trainer. It seems like what you're saying is you created almost an entire culture around walking with all these different elements.
Yeah, I vividly remember doing some of those interviews, or they were focus groups, so they were done in group settings with some of our participants. And I had one person who just said, I learnt to love to be a walker. And that was just such a poignant quote, because it was no longer just an action. It wasn't the act of walking. It was almost like it had taken some form of their personality. It had really become part of them. And, others were saying, I just learnt to make it part of my everyday kind of routine, even if it was unstructured. So there was one person who said, I always had a spare pair of joggers or gumboots or a raincoat in the boot of my car, so that if I was driving around in a new area or drove past a park that looked quite nice and I hadn't been there before, I would then, if I had, 20, 30 minutes to spare, pull over, get changed and go for a walk, because part of it was also exploring their local environment. And I think that particularly became true because of COVID, and people learnt to, and this trial was mostly conducted through COVID. So perhaps also another fortunate outcome from a trial perspective, perhaps selfishly, because the whole world was in chaos, but everyone was incentivized by walking at that point.
So what you're saying, or it sounds like what you're saying, is this culture that you created really became a lifestyle issue for those who really followed through on this.
Yeah, exactly right. And not everyone, obviously no intervention works for everyone, but for the majority, people were satisfied with the program. As in, I have a whole bunch of emails of unsolicited kind of positive quotes that were just really lovely. And it did range from just those kind of, I'm sleeping better, I'm less stressed, it's provided a new hobby, I've now joined a walking group, it's allowed me to better manage other comorbid health conditions, weight management, and really the list goes on. And so, yeah, it was so pleasing for us. And to a point, I'm almost a little bit annoyed that we didn't collect more of these health outcomes, because our whole thinking was around, preventing recurrences of low back pain for the trial. So a little bit unfortunate on that front, but nice to see that it was multi-pronged and people received benefits from a lot of different fronts.
Okay. So you studied the impact of the progressive walking and education on the low back pain. What other types of remedies have been tried or prescribed, and how do they compare to the influence of progressive walking and education on low back pain?
Yeah, so again, if we're looking specifically at preventing recurrences, let's say, really what we've done through our systematic reviews to date is establish that things like your kind of back braces, so the lumbar supports, they don't show any positive effect. Shoe inserts or insoles, also ergonomic changes at work, none of those things have really shown any evidence to actually prevent recurrences of back pain. It's always come back to that kind of combination of exercise and education, or exercise alone, that have really shown benefits. Again, with the combination of education being most effective. But nothing has really shown, you could do a multitude of exercises. And I'm not suggesting that walking is, the one exercise that is best. Ultimately, it's going to be whatever you can engage in over a prolonged period of time and keep consistent with, I imagine. But such few trials have been done in this space that it's really hard to compare our results to others. But I would say that regardless of the exercise that you look at, it would be difficult to argue that another exercise would be more accessible, low cost, simple than a walking program. Now, I know that we had this education component as well and delivery from a physiotherapist, so that's another consideration. But, perhaps that's a future study, is walking alone versus walking plus education support from a physio. Is there a difference in that? And I think it comes down to the person. So some people will have that internal motivation and ability to do this program independently, let's say, and others need that kind of assistance. So we've tried to make it as accessible and scalable as possible. But yeah, that's kind of where we're at the moment.
Okay. Did your research show how or why the walking and education were so successful in significantly reducing the recurrence of low back pain? What's going on? What's happening?
Yeah, this continues to be a bit of a black box in our world, unfortunately. So we don't know the exact mechanisms by which the intervention worked. Was it that we were getting people moving and a little bit more flexibility or strength in those joints? We're not sure. Or was it really that education component that equipped people to better self-manage their condition? And we probably think it's a combination of the two. But one interesting finding, because we looked at, I guess we haven't spoken to the results really just yet, but what we found was, since we were looking to prevent future recurrences of low back pain, we looked at a couple of different definitions. So one definition was an episode of low back pain or a recurrence of back pain that impacted people in their daily lives. So we're not talking about really minor episodes, but episodes that people reported actually impacting them in their daily activities. So in terms of those recurrences, our trial was actually able to reduce recurrences by 28%. So your risk of a recurrence by 28% compared to a no intervention control arm. Now, our other definition was looking at a more significant case of low back pain or a more severe episode. And the definition we used there was an episode of low back pain that was bad enough to cause care seeking. So this is just someone reporting, yes, my back was bad enough that I had to see some sort of healthcare. So be it GP, physio, chiro, etc. And what we found is, and this was really fascinating and lovely to see, we were actually able to reduce the risk of those recurrences compared to the control group by 43%. So, you know, that's getting close to half the reduction, right? So the element of education here, I think, probably plays a big part, because we were trying to tell people, even if you have a recurrence, and recurrences are common, so it's probably to be expected. We're not thinking that this walking is going to be the magic cure to completely eradicate your low back pain, forevermore. And so, giving people that reassurance, I think, and that clarity around, yes, even if you have a flare up, try and maintain your activity. You may need to pace back and drop off a little bit, but continuing to be active is actually going to help you recover more quickly. And again, I just really feel that reassurance and education provided by the physio might have been the element that actually stopped people from seeking care. So even if they had an episode, perhaps they felt more assured, or maybe it was just less severe, that it didn't require care seeking at that point. So if you think about the impacts, not only to the individual who has to seek this care, but the impact on the healthcare system, if we can reduce, 50% of the people who have back pain showing up to care for that episode, that means drastic impacts onto how we manage low back pain. I think it's a stark contrast to where we're at the moment.
Yeah, definitely. Yeah. What about, so you focused on recurrence. Did you do any research, or has there been any other research done looking at the walking and the education as a prevention?
Yeah. So you mean primary prevention in this case? So preventing the first ever episode of back pain?
Preventing the first episode.
Yeah. So if we look at rates of incidence, so how common is first episode of back pain? And the incidence rates are anywhere between, I think, 6 to kind of 10%. Don't completely quote me on that, but it's quite low. So to really catch someone and then run a trial, you're getting a whole bunch of people with no low back pain and then trying to catch just that 10% that might have an episode. You can imagine that that's a really difficult, costly, big trial to run. So that hasn't been done, unfortunately, as a primary prevention, is what we would call stopping first recurrence from happening. And then this is the first secondary prevention trial, so preventing recurrences. There has been some done into looking at walking for treating low back pain. So again, trying to get people better quicker. And there's good evidence for that. And that was partially the reason we decided to explore whether walking could also prevent recurrences too.
Yeah. So I believe in the article there, you mentioned the issue of cost effectiveness. How does and we briefly touched on it earlier, what about this issue of cost effectiveness of the walking and education compared to other remedies? Do you have any data on that difference?
Yeah, so not in comparison to other treatments. I guess our cost effectiveness is compared to our control arm. So what we did was we accounted for the cost in delivering the intervention. So we kind of based it on work cover rates here in Australia. So what would a physio usually charge for a typical consult time? And then we multiplied that out by the number of sessions had and the duration of these sessions. And the cost of like the walking diary and just those sort of minor costs. But when we were looking at the cost effectiveness, we actually looked and asked all participants, regardless of intervention or control arm, we asked them about work absenteeism, medication use, healthcare use, or any hospitalizations. They were the kind of 4 big categories that we used to cost, how much people had spent on their low back pain across the trial period. And what we actually found, what made the intervention cost effective, was the amount of money saved on work absenteeism. So, there was less people, who were inhibited in their ability to go to work in the intervention arm compared to the control. And that's really where we saw the cost saving element of the intervention. So yeah, really promising to find. And you know, I don't think it's often that you find an intervention that's not only clinically effective or effective in terms of reducing low back pain recurrences in this instance, but also cost effective. So I'm not sure what the kind of funding structure is for care in America, but in Australia, what we have is a funding system for healthcare that doesn't recognize prevention, to be honest. You know, you'll get subsidized or you know, free sessions of you know, care from a physiotherapist if you have a chronic ongoing condition, and you'll get 5 per year, but you won't actually get anything for a similar lens looking at prevention, unfortunately. And you would argue that hopefully this sort of research is something that we can use to lobby for better healthcare.
Yeah. And regarding the cost effectiveness, it sounds like you're talking about, and this makes sense, not only direct costs, but the indirect costs with the being able to go to work and these kinds of things. So it comes from several areas where you could be saving a lot of money on this.
Yeah, and keep in mind that, like I rattled off earlier, all these other benefits that people were feeling, there was no way that we collected that kind of data, you know. But people who had other comorbid health conditions, perhaps they were saving money on you know, their diabetes medication. I don't know. We don't have the data to support that. We were looking at purely low back pain related costs. And so it would be fascinating if we could ever have accessed data to see if there was cost savings in other elements of people's lifestyle or healthcare.
Okay. All right. Final question. Okay. Over the course of your professional career, and with all the studies and projects you've done regarding the positive impact of physical activity on health, and as we've been talking about today, especially in the context of low back pain, in the big picture of things, what's the big message, the big takeaway, the major conclusion you've come to?
That is a huge question, Joel. I will try and tackle it. I guess in my mind, and this is obviously biased to low back pain, but I imagine is relevant to you know, all health. What this study brought to light was the importance of self-management. You know, I think that members of the public, patients suffering low back pain, think that you absolutely need you know, healthcare provider to manage your issues, your health, your low back pain. But, you know, the importance of self-management, I can't harp on enough, especially after, you know, running a few trials now where we've just found that people actually have the capacity. They need to be equipped with the education and the skills, perhaps in the first place. But beyond that, the benefits of self-managing your low back pain, health, is really astounding. So I think that's probably my big take home. You're capable of managing your health probably more than you recognize.
Okay, well said. Dr. Natasha Pocovi of Macquarie University in Sydney, Australia, thanks for being with us on Up on Our Feet.
Thanks for having me, Joel. Appreciate it.